Students, today's topic is reproductive health. Reproduction is another life process just like excretion, respiration, but how it is different? It is not responsible for the sustenance or survival of an organism. It is responsible for production of offsprings. It is responsible for continuity of species. Now, when does a human being become capable of reproducing? So, the human beings, they attain sexual maturity at puberty, that is generally at the age of 10 years to 13 years, right? This age may vary from on the basis of genetic constitution, climatic conditions and diet. Now, when we talk about reproductive health, it means that when the sexual maturity is there and if the sexual act, sexual intercourse takes place, then there are two possibilities. Number one, every sexual intercourse has a potential to lead to pregnancy. Number two, contracting sexually transmitted diseases. So it is a very important topic, as there are sexually transmitted diseases which are bacterial like syphilis, gonorrhea, viral like AIDS, warts and hepatitis C. Now AIDS and hepatitis C, these are very fatal and deadly diseases. So how to protect oneself from sexually transmitted diseases, how to control the number of children, how to control population, how to do family planning. So all this comes under reproductive health. Now female body is so designed that it has to be, taken care of much more than that of a male, because only female is going to bear the child, right? So there must be proper knowledge about the age of marriage, age for childbearing, and the children must be aware of complications during pregnancy and sexually transmitted diseases. So this awareness is the need of the hour, and it is very important topic that teachers and parents must talk to their students and children. Okay. So now how to do? Now two basic things are: number one, prevent pregnancy; number two, safe sex, that is protection from the STDs. Now there are various methods which help the human beings to achieve these goals, and the first method is barrier method. Now when we talk about the barrier, now the reproduction is taking place only and only when the egg fuses with the sperm. Now if there is a barrier between the egg and the sperm, so the pregnancy can be prevented. Number two, if there is a barrier, it means semen cannot enter the vaginal tract, so the transference of seminal fluid, that is ejaculation, is also not there. Hence it can also protect the person from STDs. So barrier method can be practiced both by males as well as females. For males it is condom, and for females diaphragms or cervical caps. So these two, they act as barriers. So we come to the number two. This is chemical method of contraception, or it is also called hormonal method. In this method, there are numbered pills. Example, Mala D, Mala N, Saheli, I pill. So the woman has to take these pills regularly. Now what is the difference? This is to be done just prior to intercourse, but these are to be taken regularly. These come day wise, but these hormonal pills are there, so they can have adverse effects on the body. So next is surgical method. Now there are ducts in male as well as female which are necessary for the reproduction, leading to the fusion of male and female gametes. So vas differentia are the tubes which are transferring male gamete. So with the help of a specialist doctor, these tubes are cut, ligated, and the sperms are now not there in the ejaculation. The semen is without sperms. And in tubectomy, which is done in case of females, so the oviducts or the fallopian tubes are ligated, tied, so that the egg and sperm cannot meet. Then the fourth method is intrauterine devices or intrauterine contraceptive devices. This is used by females. This is device called loop or copper T. Now copper T is like this, it is fitted in the uterus. It's having a tube-like structure, and then the threads are there which are hanging through the vagina. Now, the major difference between 1, 2 and 3 is that the fusion of egg and sperm cannot take place. But in fourth method, the fusion can take place, but the embryo cannot get implanted in the uterus because this copper T irritates the walls of the uterus. Implantation doesn't take place. So whether the egg is fertilized or unfertilized, it comes out in the normal way during menstrual bleeding. Female even don't know whether the conception has taken place or not. The fifth method, MTP, is medical termination of pregnancy or induced abortion. Now, MTP or induced abortion is done in case of an unwanted pregnancy, that the family is complete, the couple doesn't want another child, so they go for MTP, right? Or if the doctor diagnosed that there is a serious life threat to the mother if she bears this child, so the baby can be aborted. Or baby is having certain anomalies, so if the baby is born, he will not be fit enough, right? So under that situation also, MTP or medical termination of pregnancy is done. So that is all, and this awareness is must. This awareness ensures that the person is protected from STDs. It helps in family planning. If there is family planning, then there is population control. If there is family planning, then the health of the mother and the baby is much better, right? So economic status also improves. So that is all. And here you should also remember that the population size is also determined by the rate of birth and rate of death. So if we control the rate of birth, we can control population. Hence, we must, understand and must have awareness so that we all can have a safe reproductive life. Thank you.